Hi, everyone, and welcome back to the AMR Narrative YouTube channel dedicated to bringing awareness about antimicrobial resistance, or AMR, to patients and the public. So, in this episode, we have an amazing guest. His name is Rob Purdie. Rob relies on daily antifungals to control his disease and has used his experience to help other patients. And he has also become a leading fungal disease patient advocate. In 2023, Rob founded MyCARE, the first patient-led pan-fungal nonprofit with a goal to bring fungal patients together to share knowledge and experiences and advocate for better care and increase research for their diseases. Rob is becoming a sought-after speaker and key opinion leader in the fungal and AMR communities, and his legislative efforts have included state, national legislation, and appropriations to support fungal research and awareness. And we completely applaud his work in the space of patient advocacy. And so I'm really excited for this interview. So let's have a look at what he had to say. So welcome, Rob. Thank you so much for joining our YouTube channel today. It's such a pleasure to have you. The story that you've been telling has been so inspiring. I think one of the biggest things about it is that you've been talking about your surviving valley fever, which is a fungal infection, which is something that I don't know very much about, and also antifungal resistance. And of course, there's other side effects that you suffered from that as well, that we're hoping to hear from you during this interview. So I guess the first question is, tell us more about who you are and a little bit more about your patient journey.
Sure. Yeah. Thank you for having me, and thank you for doing these interviews. I think it's a great way to share the patient experience in a way that only a patient can explain it. So my patient journey actually started on January 1st of 2012, and in a lot of ways, my life restarted on January 1st, 2012, because it's completely changed everything about my life since this illness started. And so I like to kind of start my story with a bit of a joke, because that's kind of how I am. But so I woke up with a hangover on New Year's Day, just like a lot of my friends. The only problem was I didn't even stay up to welcome the new year. I went to bed early. I wasn't feeling well, and I still woke up with what would be best described as the worst hangover of my life. Horrible headache, and really there was probably some other symptoms in there, a mild fever, but really the headache was the driving symptom that I experienced. So, after 3 or 4 days of what can only be described as the worst migraine I'd ever had in my life, the worst headache, I couldn't eat, I couldn't do anything. I went to a local clinic, an urgent care, and was seen by a doctor there. He said, "Oh yes, this is a sinus infection," and he prescribed a 10-day course of antibiotics and sent me on my merry way. So I'm like, okay, take the antibiotics, things will get better, no big deal. Took the antibiotics, completed the course. I feel worse. No improvement at all. Headaches progressing. So I decided that doctor obviously had no idea what he was doing. So I went to a different doctor at a different urgent care and got the same diagnosis, but a different antibiotic. So I continued to take those. The one thing that I think was really beneficial to me, and probably shaved weeks off my diagnosis. I know with a lot of AMR infections, you're thinking days, but with fungal infections, and specifically valley fever, diagnosis is over a period of weeks or months often. So I went and saw an ENT, a specialist, and they were able to tell me that I didn't have a sinus infection. So because of that lucky ability to get into that doctor, I was able to rule out that aspect. So then I was told I had what's called cluster headaches, and I really still don't know what cluster headaches are, but that's what they told me I had. So by the time I'm diagnosed with cluster headaches, we're now, remember this started on New Year's Day. We're now in early February. I still have the headache. it's progressed to the point where I'm basically spending my life in a dark room with no light. The light on my TV is covered, just a little red light, because it's my headache is excruciating. I can't eat. I'm nauseous. I'm vomiting. There's nothing that's helping. But I had an event that I had to go to, and so I tried to do that because it was a work function, and I was still trying to work a little bit, and not very successfully. So I did that, and in the middle of this presentation, which my wife was at, I started to see two of the screen. And so now, in addition to this headache, it's now in fact impacting my vision. So I ended up at a local hospital, and my symptoms were basically a very, very low-grade fever, and an excruciating headache and some vision issues. And actually, a medical resident, not even a full physician, is the one that diagnosed me with a fungal meningitis caused by valley fever. And so he did the first lumbar puncture on me in the emergency room at the hospital. And from there, I was admitted, and I actually got my diagnosis on Valentine's Day of 2012. So 6 weeks after symptoms started, they finally told me what I had, and they finally knew what I had. So it takes the problem. One of the issues with fungal compared to bacterial or viruses is the progression is slow, the diagnostics are slow. If you're culturing something, it's not hours, it's days, and sometimes a week. So it's a separate issue, but that's just what it took to get me diagnosed. That was 6 weeks.
Yeah, that's frustrating because 6 weeks is a long time for anybody to get diagnosed, especially, when we think about the sort of technologies that are becoming available or potentially are available at the moment, to make patient lives easier, and, the suffering that goes behind that. So, you've mentioned already how you found out how did you find out you were resistant to the antifungal medicines? You talked about being diagnosed, but were there any diagnostics that showed that you were resistant to those infections?
So that's an interesting thing as well. So what happens is I got released from the hospital in March, still just as symptomatic as ever, still ill, but on medication. And so the drug that they give you is a drug called fluconazole, which is a common antifungal that's taken just orally as a pill. And the normal dosage for most people that take this is for something very minor and inconvenient or acute, and it's 200 milligrams. I was on 1,200 milligrams. And so for meningitis, what they do is they just follow everything via lumbar punctures. And so my symptoms did finally subside. My headache finally went away probably June of that year. So 5 to 6 months of a horrible headache. But what happened is, while I got somewhat better, I didn't really get a lot better. And so my doctors, because there's big issues with susceptibility testing with fungal as far as availability, what they do is they follow your clinical improvements and your clinical things. So they'll look at your glucose and protein and white blood cells in your serum and your bat. And so that's how they track my my progress, if you will. And in October, I ended up back in the hospital, and then through that process, they realized that the drug wasn't working, and then they put me on a different drug. So, oftentimes they'll do MICs or something like that to establish resistance. They don't do that with this. They just move to the next one. And even then, it was still 3 or 4 days just to get the drug changed. If they were trying to figure that out, then it would have been weeks. But what they do is they look at the drug levels in your body to make sure you have the appropriate amount of drug in your system. And then if your improvement isn't tracking, then just by process of deduction, they acknowledge that is not the appropriate drug and move you to a different one. So I did that in October of 2012, and then again 6 months later. And then at the end of 2013, the third drug that I was on was also not improving. I wasn't improving clinically on that. So they added another drug to that called amphotericin. So amphotericin is the oldest antifungal actually. And it's not available orally, so they have to inject it to you in a specific point. And so because there's difficulty crossing what they call the blood-brain barrier, because my presentation was in my central nervous system as a meningitis, they inject it directly into one of the ventricles of my brain. So this is actually a port on my head where they inject the medication. So they start out doing that twice a week, and then they spread it out and spread it out. And the goal is to get to 6 months or longer, and I've gotten almost to 6 months. So then the reality then is that I am now an AMR patient diagnosed with a 70-year-old test and treated with a 65-year-old drug. So that's the difficulty with fungal as compared to some of the others. There's only 3 classes of drugs. The newest class of antifungal was discovered in the 90s.
Yeah, you know what, I remember attending one of your presentations where you said it's like trying to put out a fire with like I don't know if I got this right, but like a 1940s fire truck, you know.
Mm-hmm.
When you've got
Yeah.
all that technology, there's so much more you can do. So I guess, my next question, and this has led on to it really, really well, is, what do you think we can do better in terms of, healthcare professionals, patients, and so on, and again, diagnosing it sooner so that, people don't go through what you've gone through?
Well, that's a really easy question and a really hard question, because fungal specifically is very, if you look at the amount of money spent on AMR or infectious disease, fungal is a very, very small percentage of it. So anything is better than what we have. So we can't get much worse. We're even in the global north, in these high income countries, we're still just getting crumbs off the infectious disease and AMR table. And it doesn't get better if you think about the LMICs of the global south. It doesn't. There's a lot. So I failed 3 azoles, 3 drugs in the same class. There are a lot of countries in Africa right now where at least one of those drugs is not available. So there is a need for diagnostics, because we also don't understand the true burden and the scope of the illness. Now, granted, that's somewhat true across all of the AMR spectrum, but diagnostics and surveillance are one of the first things we need to do. And people don't think about fungal infections. They think about bacterial. They think about TB. They think about respiratory, HIV, but they don't think about fungal infections. And if they do, it's because they're thinking it's a secondary infection in a very specific type of patient that's got some other comorbidity, some pre-existing condition. But with some of these fungal infections, especially ones like valley fever, which are tied to a geographic region, they're geographic, what they call endemic infection or endemic mycoses. All you have to do is be in that area. And we saw that. And recently, there was some news around the world about a group of 5 or 6 people, it might be more now, that were infected with valley fever at a music festival, literally 30 minutes from my house. And these are just 5 or 6 cases just in California. These are people that visited from other parts of the state. And that happens all over the world. So even a regional disease, even a geographically limited disease is a global issue, just like AMR, because we live in a global world, where everybody's traveling.
Yeah, that's so true. I always see that, when we talk about AMR, which we know, is antiparasitics, antifungals, antibiotics, and antivirals, a lot of emphasis is on antibiotics, probably because people recognize that more than what they recognize the other medicines that we're using to treat infections. But yeah, as you say, this is something that I'm still learning about, and a lot of people are still learning about. Where does antifungal resistance fit into it? And it's a huge priority. It's a huge priority. So, this is why your story is so important. So you're currently a leading patient advocate for AMR and especially for antifungal resistance. And your work has been absolutely amazing. So, let me just commend you for that, first of all.
Thank you.
Also, having shared your story at some high-level meetings, including Congress in the USA, as far as I've heard. You also co-founded a charity called MyCARE, And this is something I'm really interested in finding more about. I mean, maybe you could tell our listeners about, about your charity and what it does.
Yeah. So one of the things that I've learned over my time working with valley fever patients is I had the opportunity to meet and speak with a lot of physicians who don't treat valley fever patients, but treat patients with other fungal infections. And what we learned is that there's a lot of commonality with these patients. So fungal infections are often considered rare. Um, so there's not enough of us to really advocate or even do a good job of providing information as a small group. So by addressing all fungal infections and looking for the common denominators in delayed diagnostics, lingering impacts, sometimes debilitating um, issues that you don't lose. Some people, I know people that have lost limbs to valley fever, just like any of these other, infections. Um, so there's a lot of opportunity to look at the commonality. And once we establish that, we also recognize that patient advocacy is what's going to be needed to address fungal overall. And really, AMR is the head of the snake, and we have to address that to fix fungal and to fix valley fever. But our goal is really twofold. Um, and so the first goal is to help patients, right? And how do we help patients? A number of ways. First of all, the resources available for patients about fungal infections are really not what patients care about. So I can learn about epidemiology, diagnostics, and treatments, from a very clinical, like informing a doctor at a high level. But when you're a patient, you want to know, what's my life going to be like? What can I tell my kids? Can I say, yeah, I'll be at your baseball game in your high school graduation when you're 13 years old? Yeah, I can promise I'll be here in 5 years. And what's going to happen if I take these drugs? How long am I going to take these drugs? What else is going to happen to me? So we started building that out. So, and it's a very lengthy process to build a website to address one disease. We're addressing dozens, one disease at a time, and looking and kind of highlighting some of the similarities. So it's a very difficult education aspect of our job, or our mission, really. And so we want to do that, and also help patients, through sharing stories, encouraging and developing advocates, because there's not enough of us, right? And then the second aspect is policy. So the other way that we help patients is by um, engaging with policymakers and stakeholders to allocate resources. So, we don't want the crumbs off the table. We want a seat at the table, and we need that. And the only way to get that is by addressing policymakers and clarifying the difference between antibacterial, antifungal, AMR. So we have to educate them, but we have to educate them with purpose. And the starting point of that is patients, because we can get attention in ways that others can't. And our stories are powerful. Um, but if you rely on like things like industry, oftentimes they see the story of a patient as the endpoint, whereas I think you and I see it as the starting point for a conversation to lead to action. And that's a very big difference in perspective that can lead to a very big difference in outcome.
Yeah, you know what I mean, and I mean, I just have to say, like I said to you, like I think your charity is amazing, and this is like, it's a very rare charity. I think when we've had conversations before, I've heard you say to me, we're trying to build an army of patients,
We are.
and it's so important because I mean, patient voices, as you said, is like, we need to understand the human impact of exactly what's happening behind the scenes. The same way that has happened in other disease groups and other disease advocacy groups. So this kind of leads me on to my next question. I mean, I've heard your whole story, and we've spoken about the charity and so on, but I mean, what made you decide to become a patient advocate? And have you got any advice for other patient advocates also seeking to raise their voice for AMR?
I became a patient advocate because I was somewhere between frustrated and very, very mad. Um, And the reality is, because of my disease, I had a lot of time where I couldn't do anything. So I started doing a little research. And part of it was like, trying to figure out the questions that I'm trying to help other patients answer through this website, these resources, looking at things like, oh, you can do this, and this will help cure it, and this and that. Because it's not curable, it's controllable. So, looking for a way to make sure that I was there for my family. And then also recognizing the lack of resources and being very frustrated by that. And having, and the thing that's really hard to quantify is, so my hospital journey was, I don't know if it was unique, but it's something that's not talked about a lot. So when I was hospitalized, I was the income provider for my family. My wife stayed at home with the kids. So as sick as I was, and looking at my wife as she's looking at me, she doesn't think I'm coming out of the hospital. So I feel the worst I've ever felt in my life, and I'm spending half my energy just making commitments to my wife that I'm not going to die on her, because that's what she thought. I mean, I had friends, a lot of friends didn't come visit me, and that's a whole separate issue that you learn about as a patient, that you become somewhat alienated. But the ones that did were looking at me different, like this is the last time they're going to see me. So I had to, I didn't have the opportunity to sit and just be sick. I had to worry about my wife and my kids and making sure that they knew that I wasn't going to give up. So I had to commit to fighting, and said, I'm going to fight. And so I have been, um, and they've supported me. And, I can't say enough about how much what they've done to support me has made this possible.
Yeah, well, you know what, your voice is being heard. That's the first thing I want to say. And you know what, like I've learned so much from you, and I think so many people are learning so much from you, and it's making a difference. I know that you're part of the WHO task force of AMR survivors as well. Besides doing your charity, which you amazing job with that. It's a pleasure. It's an absolute pleasure to know you and to learn from you, Rob.
Thank you.
So yeah. I think, I guess to wrap up, I just want to say thank you so much for being here. And, and I think all our audience is going to be looking forward to learning what you do going forward, and to learning from you, from your experiences, and all the other work that you do to raise the voices of others. So thank you for being here today.
Thank you.